Because October is Breast Cancer Awareness Month worldwide, we
Yes.
decided to talk about breast
Breast
cancer
cancer.
and how nutrition can help with breast cancer.
Definitely.
So that's our
definitely.
topic today at the What the Actual Health podcast.
Yep.
And first of all, Harvey, how many breast cancer patients does the center see?
Okay.
Maybe in a month, in a year,
Ganito na lang. In 16 years that we've been working together, that we've been working at Baron Method, no, you won't believe that 2/3 are actually cancer related.
Okay.
And breast cancer is the most common cancer we see at the Baron Method.
And then how old is the youngest, would you know?
We get them as early as 20s to as old as 70s.
So for breast cancer, is it really more genetic? It is, no?
I think
Primarily, it is genetic.
yeah, I think you can say genetics is the you have it in your genes, but if you don't eat well, then this genetic speeds up.
Kumbaga, you wake up the genetics.
Yeah, kasi genetics don't have to be awoken, right? But if you eat a certain way or you live a life a certain way, you smoke, you drink, then genetics has
Puyat
no
ka lagi.
choice but to
Kumakain
Yeah.
ka lagi ng masamang
yeah.
pagkain.
So genetics has no way but to speed. Food has no
To
way
manifest.
yeah, exactly. Lalabas at lalabas.
Genetics has no way but to manifest faster.
Yeah, exactly.
Yun siya.
Oo.
Okay, sige. So, as per usual, the reason why we are discussing this topic is because we do want to give tips.
Yes, we do.
Let's start with tips for prevention.
Sige.
Okay.
Sige. So, key here is definitely lifestyle.
Uh-huh.
No? So, one of the main common things I see with people who are diagnosed with breast cancer is that their diet is really horrible. As
Okay.
in really bad. You're talking about processed food, junk food. It's always there. It's always present in every diagnosis. When we take their blood sugar, their blood tests, their D3 is very, very low. So kailangan maganda yung D3 levels nila. Then factor in mo yung lifestyle nila. You'll see that they sleep very late. Yun factor yun. And then they also, some of them, not a lot of women we see at the center smoke a lot. So but we know that it's a factor, and we know that drinking alcohol, anything that spikes up acidity in the body is oftentimes a trigger to breast cancer.
And I also heard of people na sinabihan daw ng doctor not to eat red meat because it causes cysts in the breast. But at the same time, these people eat a lot of tofu naman because they replace the meat with
Okay.
tofu. Can you care to comment? Again, this is what Harvey knows.
Okay.
In the 15 to 16 years of practice.
Yes, okay.
And the things that you have researched.
The what we see as the number one trigger is really, when it comes to food, is really sugar.
Okay.
It's sugar that boom.
Sugar talaga.
Sugar talaga.
Pero diniding mo nice nung particular doctor na yon, nung friend ko, red meat. When
Yeah.
what research has shown is refined sugar really feeds cancer.
It's really refined sugar. In
Okay.
fact, when we work with a lot of clients, what we see is the more refined, the more processed the diet, the more clear the breast CA talaga. Talagang that goes without ano.
So again, to recap, prevention, it's really avoiding foods that heighten the acidity levels in your body that can wake up the genetics, your family genetics, your genetics that have breast cancer.
Yeah.
Okay.
Now, when we prepare meal programs and diets for people, it has to be sustainable.
Okay.
It cannot be, I will not eat sugar or carbohydrates for a short season. Kasi baliwala yun eh. You're on a diet for 3 months. Then after that, kung ano-ano na kinakain mo. Wala
and
din
this
yun.
goes for food deliveries as well,
Yeah.
because we always get that question now, why doesn't Baron Method have a food delivery
Yeah.
system?
Mm.
It's because we aim to empower.
Yeah, empower
Because
talaga.
after a food delivery program,
Wala ka
then you go
natutunan.
back to eating the usual, wala rin.
Yeah.
Diba?
Exactly.
Anyway, okay,
Exactly.
go back
So
to...
it's not, pero you know how we said that sugar is the main trigger.
Yes.
But sugar is actually classified as a technically under the umbrella of a carbohydrate.
Uh-huh.
So which is why sometimes carbohydrate as a whole,
Gets
kinakawawa.
yes,
It's
demonized
demonized
na.
talaga. Oo. So it's not actually that you should avoid carbs, but you avoid the bad kind of carbohydrates. Diba? So if you eat bad kinds of carbohydrates, this is where the your genetics start to awaken. And then this is where breast CA and other forms of CA become an issue. But in general, I'll tell you from the experience that we see. If you eat meat, it's not a bad thing. It's how meat is prepared. It's how meat is
True.
cooked. It's how what reused oils. So if you go to a fast food and they reuse oils,
And then they do red meat,
yeah, and
then it might not be the meat.
It's
It might be the oil.
it might be the oil that's repetitively used. It's all of that na patuloy-tuloy. It's the gravy that they add it. It's
Or
other
it's
things.
the manner of cooking na gustong-gusto mong kumain ng puro sunog.
Exactly. It's
That's
also a
also-
trigger too.
yeah.
So
Oo.
please, it's not just, don't blanket it and say all red meat is bad.
Yes, yes.
Because it's not. In fact, if a person comes in here 50 years old sila, they've been eating red meat an entire lifetime, automatically you take it out from their eating protocol. How on earth will that be sustainable for them? We just need to fight our battles and tell them, okay, prepare your food a certain way, use these ingredients, make sure that they're clean, make it as tasty as possible, but it's still healthy. Then it's viable, it's long term. And then we insert what we call high value nutrients that will help counter the cancer, boost the immune system, and in that case, what it will do is it will limit the side effects of chemotherapy.
Correct.
So ganun ang
So,
nangyayari.
wait.
Nauna na ako.
Oo,
Oh,
papunta
sige.
na tayo dun eh. What
Sige.
if you already have breast cancer? What are the tips that you can give, especially for those undergoing radiation and chemotherapy?
Okay.
A couple more tips siguro, one or two more,
Alin,
before
alin?
to prevent, I guess, breast cancer?
Yeah. Okay. Obviously, some of the things that
Or just one? Sige.
okay, I don't like yung deodorant spray.
Antiperspirant.
Antiperspirants and
Yes.
deodorants na they seem to have
They trap
they-
the sweat.
they seem to have a very negative impact. There are studies against, there are studies for.
Mm-hmm.
You know, you can choose which science to believe. But I would like to believe that when every time somebody comes in here, I ask if they're taking if they're
Using
using
antiperspirant,
antiperspirants or
oo.
even deodorants. Oh, we use it. Yes, and I tell them stop using it.
Lymph nodes kasi
Yes,
here, eh, no?
yes.
Near the breast.
Oh,
Okay.
oh. So those are some of the things. And of course, for women, a lot of women are more busy now than they ever were,
Mm-hmm.
right? So sometimes they don't handle stress as well.
Okay.
So sometimes the best way is to hard naman to say, don't stress out, right? Because the world is just
No, you find the balance,
Yeah.
how to counter the stress.
yes, you do. So sometimes countering the stress, you can go for your exercise. You love
Pole.
infrared sauna, pole, things that make you happy. Do it. Do those things. Find really good avenues for managing your stress, right?
Correct,
So
correct.
again, balik ko dun sa sauna, and again, yung pole mo or those types of activities. Hanging out with your friends,
Now,
going shopping.
sige. Let's go na to what are the tips that you can give to someone who already has breast cancer
Okay.
and is probably going through treatment,
Oo.
whether it's chemo, radiation, and the things that they're going through with their body, the side effects of the treatment that they're receiving.
Okay.
Tips.
Okay. This is from a nutrition perspective. Ha?
Yes.
Okay. When a person comes in here or calls me about cancer, usually the biggest fear after being diagnosed are the side effects of chemotherapy.
Yes.
That's clearly number one in the fear of why I would not do traditional treatments. But if you ask them the question, if there's no side effects or a very minimal, would you continue with the treatment? They would say, Yes, of course. Right? Syempre, who wants to live with the idea that there's a cancer in their body? Syempre, wala. Right? But they also don't want to go through the pain and hassle of going through the treatment.
Yes.
Okay.
Okay, number one. If they are doing chemotherapy, what are the side effects usually that you guys see?
A lot. You will get nausea, loss of appetite,
Metallic taste. I
metallic
remember,
taste,
yeah.
loss of taste, diarrhea, fever, everything.
Let's share what we give when they are dealing with
Okay.
nausea, for example.
All right. Normally, when you ask the person who treats you, Doc, can I eat anything? The normal statement is,
Yes.
you can eat whatever you like. All right? From our experience, which is right now over thousands, maybe 3,000 patients already with cancer, I will tell you, if you don't fix your diet, you will definitely feel the side effects.
Okay. Okay.
Yon. So, you're talking of making sure that you're getting good quality. You cannot eat whatever you like. It's no longer something that is
Viable.
I would say viable and reasonable, lalo na if you really want to help yourself, na wala kang less side effects. Kasi the foods that we promote at Baron Method, phytonutrients through vegetables, through juicing and other things like that, boost your immune system. Logic lang. If your immune system is up, then most likely you won't feel horrible. You won't
Correct.
feel lousy. So, ganun yung focus natin sa Baron Method.
Pero yun, apart from good food,
Oo.
let's say, particular concerns, nausea, diarrhea, what are the quick fixes, I guess, that you would recommend? Is there any?
Besides, okay, this is assuming you're already fixing
Eating
your
well.
eating well,
Yes,
fixing
oo.
your diet, ha. Because even if you take a supplement, even if you take a juice, even if you take something as a quick fix without fixing the overall, it doesn't have the same impact. So, like for instance, if you're feeling nauseous, taking a ginger tea with lemon works really, really well. But if you're eating shit, then that thing will not have any impact. It won't help.
Okay.
Ganun yun.
Other tips?
Other tips would be go out, get some good sunlight. Definitely sunlight will help. D3 supplementation is good. Probiotics is definitely very good as a supplement. Vitamin C to keep the immune system up.
Papunta na ako doon actually.
Okay.
For those naman who are doing radiation, they get radiation burns. We often recommend probiotic skin spray.
Probiotic skin spray
And
works
VCO.
really well, and VCO.
So that the burns
Yep.
would heal better.
Yes, definitely.
Apart from using antibiotic cream, anti-whatever cream, it's about restoring the flora of your skin.
Yep.
Tama ba?
Yep. Yep.
Am I correct in saying that?
Yes, correct.
Okay.
Correct.
What other tips for cancer patients?
Okay, normally when we give tips kasi it's really dependent on your symptom or your side effects. But the tips I gave earlier, those will cover a certain amount of making sure your immune system is strong already.
But I know that your cancer patients, breast cancer patients, you prescribe a lot of juicing.
We do. We like juicing. We like juicing as a whole because per mouthful, you're getting an extreme amount of nutrients.
And that's super helpful when you don't have any appetite as a side effect
definitely.
of cancer treatment.
Definitely.
Yes.
Definitely.
And
Eizza, before I forget, when we get cancer patients, breast cancer patients or any cancer patients, we prefer to get them early.
even before they start
Even
treatment?
before, kasi we can build a foundation that protects their immune system and the good cells in their body.
Ito yun eh. Ito yung difference kasi when you're eating well versus someone siguro who's not eating well. Pwedeng continuous yung treatment. Walang pause in between because
Maganda rin yung blood work.
yes,
Oo.
because after treatment, you could be so sick and so frail that you have to delay the next treatment.
Do you remember some of the testimonials
Yes,
you've
of
seen?
course, oo.
Okay. A lot of them. The
Which,
overall...
by the way, we are linking the testimonials in the description if you're interested to see the testimonies we have when
Yeah.
it comes to breast cancer. We have the links in the description of the podcast.
Do you remember a lot of them will say that prior to doing the program, they would vomit, they would feel all these things.
Yes, yes.
But during the program or when they do the program,
Meron nga eh.
wala.
Chemo sa umaga,
Back
then
to work.
pasok
Yeah.
in the afternoon
Yes.
because she doesn't feel anything.
Yes, exactly.
She's
exactly.
okay. She's absolutely
And
okay.
they don't even get infections.
Mm-hmm.
Meaning wala silang hindi sila nagkakasakit o nagkakaubo. What does that mean? It just means that even with the treatments, even with breast CA, their immune system is so good. And that's what we're trying to promote, diba?
Yeah, so whether you have breast cancer or not, preventive side, you have to eat well.
Yeah.
If you do have breast CA and you are doing treatments to avoid the side effects and to be equipped to have continuous treatment, you also have to eat well.
Yeah.
So eating well is really a foundation
It
for
yeah.
whether you are already sick or you are not sick yet, but
Correct.
you have family history of the disease.
Correct.
Then you might as well, diba? I mean, why not?
Tsaka, you know, a lot of people say, will come in here, eat healthy, edi tapos na, sira na yung, wala na yung buhay ko. Parang pinatay mo na rin ako. That's such a old way of thinking that irritates me. Nagagalit ako minsan inside, no? Kasi just because healthy...
Bilang inside, galit ka talaga.
Galit talaga ako kasi ang healthy eating does not mean hindi na
Your
pwedeng
life
masarap
ends.
yung pagkain
Correct.
mo.
Oo.
It can be both.
You can always find alternatives.
Yeah, definitely.
You can always find ways na to make your favorite food without compromising your health. And that's what you always say naman
Yeah.
in the practice, di ba?
And I have seen too many things to not fight or tell clients, make the sacrifice.
Oh, and you know what he always says to clients and patients is, you know, whether you listen to me or not, you've already paid me. I'm here to tell you without filter what you need to do.
Yes.
So whether you follow or not, it's up to you.
Yeah.
But at the end of the day, what I'm trying to tell you is something that I know can help you.
Not because of theory, huh?
Oo.
No,
Because
because
you've seen
we've not
cases
seen
and
and
cases
helped
with-
cases of about with people like this. So it's why I will tell cancer patients or breast cancer patients out there, don't take your diet for granted. You cannot eat whatever you like when you're diagnosed with CA. You cannot. You have to make good choices. Bottom line, ganun yun.
And actually, I think we can end there. It's all about making good choices. Ngayon, actually, I don't want to end there. Kasi there's also, pinagtawanan na ako ng asawa ko.
Sige, go.
No, kasi there are people who you'd always talk to and say na, healthy naman ako eh, hindi ko alam paano ako nagka-breast cancer. Pero pag hinimay mo na yung eating nila, it's not actually healthy.
Right.
So again, this is why Barren Method also exists.
Yeah.
It's because there's so much information out there that you don't know what to take and what not to take.
Gulo na eh.
Yes. One person's healthy might not be healthy enough
Right.
to prevent disease.
Yes.
So maybe you think you're healthy, maybe you think you don't need help, but you'd be surprised what a truly healthy
Person.
food intake
Yeah.
can mean in terms of your energy, your health, and all of that.
Avoiding preventing disease and
Yes.
and trying to fight disease while you
Yes.
have it now, diba?
Absolutely. And yon, I promise, that's how we are going to end today's episode na talaga.
Pasensya na kung galit ha. Medyo yan kasi yung
Passionate lang siya,
passionate,
hindi siya
intense
galit.
na intense lang.
Okay? So, I hope you picked up something from that episode on the What the Actual Health podcast. And we wish all the people who are battling breast cancer and the caregivers of these breast cancer patients, just keep fighting. And
Yeah.
I hope that you...
God bless you guys.
Yes. And
Oo.
I hope that you find the healing.
Yes, definitely.
Yes. Thank you. And that's it.